remember the $6 million man who was a fictitious character made of superhuman parts. Today, that's closer to reality. From injury to arthritis, there are several parts of the body that can be replaced so you can go back to your normal life. Take, for example, your knees. It's easier than ever to get those joints in working order again. And here to explain, please welcome surgeon Dr. Justin Chronister with Onward Orthopedic. Good morning. There's always like checks and balances here. We're living longer today than ever before, but there are some parts of our body that we're wearing out. They're not living as long as us.
That's right. That's right. You know, because we are living longer lives, at some point, you know, our joints are going to wear out. We're more active, so you know, the cartilage in the knee, the cushion part in the knee that keeps us going, will wear out over time. You know, they're kind of like our tires, and over time, all tires wear out as long as you drive enough miles on them. Yeah,
and we are driving some miles on our knees, aren't we? Okay, what are we looking at right here?
Okay, so this is a couple x-rays of the knee. One's a little bit healthier knee. The one on the left side, or right side, I guess, for the camera, is a very worn out knee. And what you'll notice is that the bone parts of the knees are almost touching each other. And that's why the cartilage has thinned out so much, where the bone starts to rub itself. And that causes lots of pain and dysfunction.
Yeah, so there can be an actual injury to your knee, or arthritis is probably the #1 reason?
So, yeah, so there's a couple different arthritic conditions, but really the most common one is osteoarthritis, or degenerative joint disease, which is really just truly wear on the knees.
Yeah.
And that just takes high activity level and time, age.
Yeah, all right. So the procedure, and we were talking about during the commercial break how things have changed. And a lot of times people will see their parents or grandparents have gone through something years ago, and they think, I don't want to deal with that recovery. It's a different procedure today. You have this kind of model here. And tell us what we do differently today that makes the recovery easier as well.
Well, there's a couple different things. So our management with pain, with anesthesia, and doing regional kind of control blocks for pain have improved the pain levels afterwards. It's improved our functional rehab time. In the surgery itself, we have also become more minimally invasive. With our incisions, we're able to stay smaller.
Yeah, which means recovery time is faster.
Recovery time is faster. Our bone resection part, or the part where we have to remove the arthritic segment of the knee and place the implants in there, is smaller and more minimally invasive. The real advancements are also with how we place with the components themselves. The components and how we make the components and the materials in the components last much longer. So, as of 15 years ago, so here's some components. You know, it's a couple metal pieces that are securely placed onto the bone, and then the plastic piece in the middle. We know that these will last 20 and maybe much longer years after they're placed into the body. And we couldn't promise that 10, 15 years ago.
Right. And I'm looking at right here. It seems like with this kind of smooth, I don't know what kind of metal or whatever this is, but that it would be a much smoother movement.
It is a much smoother movement. We're making much more natural knee designs than they used to, and again, it's that plastic piece in between that has a very high wear rate, so they last a very long time.
Yeah, not everybody's the same, so you have a personalized replacement. So how you can do this in a way, explain what that is.
So there's a couple different new technologies, and one of the ways is they take really high advanced imaging techniques and put that into computer programs, and they design the component or the tools we use in the surgery so we can make a very personalized anatomic knee for you. And one of the ones that I utilize is actually where they use the imaging techniques and then intraoperative robot technology with which we are able to place those implants in the most anatomic way that we can.
Yeah, there are ways to postpone your knee surgery or avoid knee replacements. And I say avoid is kind of a tougher one, but for a lot of people who keep putting it off and putting it off, are you doing more damage by putting it off?
Well, I mean, it's going to be continued wear, but you know, we have all kinds of conservative management, which can make people go for a long time, and sometimes they won't even need the surgery.
Injections, for example?
Injections is one great management method, and there's a couple different types of injections. One's anti-inflammatories, another one's a gel injection where we kind of synthetically place the knee fluid back in the knee, and some of the new technology as well is using stem cell injections.
Oh,
and
wow.
This is very new, and the science behind it's very new and limited, but some of the early results are very promising with increasing people activity level, function level, and in decreasing their pain levels.
Yeah, you even had knee surgery.
I did.
I did. You put it off for a while though, because you had this thing I think called medical school that was kind of in the way.
That's right. I actually tore a ligament in my knee in medical school and waited my entire residency and got it fixed at the end of my training.
Yeah. Okay. Tell the truth. Were you nervous getting it done, or you so understood it was no big deal?
You know, you're nervous. You never want to, just jump into surgery. But it's kind of funny. Through the whole time, I was kind of putting it off. I don't want to do it. I'm not nervous about surgery. But as I'm doing it to people, giving them surgery, and fixing people, at some point you have to say, well, I think it's probably okay to do.
Yeah, but the thing when you say, I had it done, I get what you're talking about. But the thing is recovery. We talked about most people use a cane or a walker a day after surgery, but they're up and going shortly after that, which was not the case in years past.
No, not at all. And again, that's with our technique in surgery as well as the new advancements in anesthesia. I mean, for my protocol, people are walking the afternoon after their surgery. And in most cases, people are mobile enough to leave the hospital on the first postoperative day or even the second postoperative day.
And can we wear our high heels? That's what I want to know.
Eventually.
Eventually. That's all I want to know. Okay.
Yeah, you eventually did.
Thank you very much. To learn more about Onward Orthopedics, you can go to onwardorthopedics.com/KHOU or call this number. It is 281-310-5578, 281-310-5578. So kind of end your pain and get up and moving again.